There are many different ways that we can administer medications. So we can do it through the intravenous mechanism, so that's through a cannula. We can do it orally, so that's ingesting or swallowing medication. We can apply medication to the skin. We can inhale medication. We can have medication in a suppository form. So this little segment here, we're going to be talking about the different ways that we can administer medications. The most important thing before we start administering medications is to ensure that we know the pharmacodynamics and the pharmacokinetics of the medication that we're about to administer, meaning we know how the drug actually works and how it reaches its target area. We need to know how that drug gets broken down by the body and how it actually gets eliminated by the body. All of these things are really important so we can inform the patient, educate the patient on the medication that they're receiving, and what are some of the side effects that they may be experiencing or expect to experience. So what I have here today are some different types of medications and different routes medications will be administered. So we have sublingual medication. So this is medication that is absorbed in the mucous membrane under the tongue, such as antonine. We also have inhaled medication, such as salbutamol in asthma treatment. So there's two ways with that. There's the puffer and there's also the use of the spacer. We have topical medication such as creams and lotions. And it's really important to remember that the topical medication needs to be prescribed, and usually in a hospital environment it's one person only. So you wouldn't have a lotion or an ointment in the medication trolley that you would use for multiple patients. You would have the pharmacist prescribe that just for, or dispense that just for the individual patients. We also have patches. So this is a Transiderm patch, but we can also use nicotine patches as well. So these are like stickers or dressings that we apply to the patient's skin. There are eardrops, eye drops, and suppositories. So you can have anal and vaginal suppositories. So when we're administering a sublingual medication, it's really important that we don't touch the medication with our hands at all. So when we're moving the lid, we ensure that we don't place that lid down on any surface. We hang on to that. We don't want to get bugs from the surface inside the lid and then the lid inside the container. We tap the jar until we have one of the tablets out and place it into the pill jar or the pill cup. Then we'd go and administer that to the patient, ensuring that the patient is aware that this needs to be absorbed under the tongue. Inhaled medications will be prescribed as in puffs. We can have continuous nebulizers where we put a face mask on the patient and would nebulize a amount of fluid. However, we also have Ventolin puffers or salbutamol puffers or steroid puffers that will be ordered as 2 puffs TDS or 2 puffs BD. So there's two ways that we can use the puffers, and one way is just removing the lid, giving it a shake and depressing the puffer. At this point, the patient needs to clasp their lips firmly around the mouthpiece and breathe in as they dispense the container. They need to hold that for about 10 seconds before the next puff. The other way it can be used is by putting the puffer in the end of the spacer. The important thing when you're using a spacer is that you prime the spacer first. The more it's coated, the better it is, because the plastic actually absorbs some of that medication. So once it's primed, we can take the cap off, ask the patient to put their lips firmly around the mouthpiece, depress the canister, and again they inhale and hold for 10 seconds. Lotions and ointments really need to be applied. I prefer to empower my patient and ask them to apply it themselves. So I would squeeze some of the ointment out onto the patient's hand. If they're able, they can apply it themselves. However, because this is topical, it's designed to be absorbed through the skin. I will be applying this by using some gloves because I don't want to absorb the medication. So when we have patches, it's really important that we ask our patient where they would like that applied. And once that's applied, a really good thing to do is actually to write on the patch the date and time that it applied, and the little signature there is really nice as well, because usually this will be ordered as apply at 8 a.m. and remove at 8 p.m. for instance. There'll be a variety of that. There'll be an on-off approach to applying a patch medication. So it's also a nice thing to write on there that was applied at 8 a.m. to be removed at 8 p.m. Eardrops is another form of medication. So eardrops will come as an antibiotic or even a wax softener that you'll find. So it's really important when we're administering eardrops or eye drops is that we maintain the aseptic technique that we have, and we ensure that we don't cross-contaminate and pick up bugs from placing the cap down on a surface. It's really important that when we take a cap off, that we keep hold of that in our little pinky. It's also really important that we position the patient properly, because if we apply these eardrops and the patient is sitting upright, it may actually just drip out, and that's absolutely pointless. So it's really important that we position the patient and we apply that eardrop, and we can actually manoeuvre the pinner of the ear and to ensure that that eardrop actually goes exactly where it's intended to go. So we'll demonstrate that. And then we have eye drops. So eye drops, again, we need to be really careful how we manipulate the lid. And I always like to keep the lid with me. And so I'm not placing it down on the surface, I'm keeping it with me, and I'm ensuring that I'm not getting any bugs from the surface onto that lid and back into the container. With eye drops, it's really important again, as with eardrops, is positioning the patient. So we like the patient to be sitting up a little bit and to get them to look up as we pull the lower lid down and distill the drops. The other important thing about eye drops is that we put a little bit of pressure on the inside of the eye, because we know that our sinuses all drain into the one spot. So we don't want the medication just to drain straight through our sinuses. We'll try and keep it in around the eye where it's actually been designed. So a little bit of pressure on the inside of the eye to reduce the drippage down to the sinuses. So suppositories. As I mentioned earlier, we can have rectal suppositories or vaginal suppositories. I think the most important thing to remember about suppositories, especially if we're applying them rectally, is that we're not going to be inserting them into a mass of faeces, because it won't be absorbed that way. It will just sit in the faeces and be defecated out. So it's really important that when we insert a suppository rectally, that we insert it aiming towards the left. So we want to go to the wall of the rectum. Patches and inhalers. We're now going to refer to PO medications, per oral medications. So usually you may find that medications are locked in a drawer beside the patient's bed in some facilities. Some facilities advocate a medication trolley where all the medications will be, all the generic medications will be in the trolley, and you'll take that trolley from bed space to bed space with the keys, ensuring that you lock it as you go through. Some facilities will just have the patients having their own medications, and they're responsible for those by themselves. So you really do need to work within the policies of the facility that you're working within or going on workplace learning. When you do oral medication administration, it's important that you have your medication chart with you. There may be more than one medication ordered for 8 o'clock in the morning, for example, and you're not required to take one medication to the bed and then back for the second medication. You actually can take multiple medications at the one time to the patient's bed space. So to get an oral medication prepared for a patient, you will need a medicine cup or a pill cup. You will need the medication chart, and you'll need a MIMS. If you're unfamiliar with the medication that you're going to be administering, you need to look that up. You need to read about it. You need to read about what the action of the drug does. And I mentioned the pharmacokinetics and the pharmacodynamics earlier. It's really important that you have a good understanding of what these medications do, so we can inform our patients on what they may or may not be able to expect from this medication. Oral medications can come as tablet form or suspension form. So a typical suspension form medication would be paracetamol, for example. And you have a variety of ways that this is ordered, and we'll be discussing that in a tutorial setting. However, you may be ordered something like 5 milligrams of paracetamol. So how do we get 5 milligrams or 5 mils of paracetamol into a medicine cup to administer to the patient? There's two ways. You can actually pour it into a medicine cup, and you'll actually see that this says 5 mils, 10 mils, 15 mils. You'd be familiar with this at home. Or you can use a syringe to actually aspirate the medication from the bottle, and then give that to the patient. I find using a syringe and aspirating it into the syringe is really a nice way of giving it to children, and you can just squirt it into their mouths, or you can actually give it to them and they can squirt it in their own mouth, which is quite a nice way to administer paracetamol. So to do that, once I've checked my medication order and I know exactly how much I'm going to give, you take a syringe. I always like to give the bottle a little bit of a swish. Again, either hang on to the lid or place it upright on a surface. So you can use a syringe to administer the oral suspensions, and in some facilities you'll have colour-coded. I think New South Wales Health, they have colour-coded oral syringes to ensure that we're actually going to give that medication orally and not get confused and give it IV. There has been many clinical governance reports about oral medications being administered IV and the result is death of the patient. So nowadays we have colour-coded syringes that are designed and specifically needed to be used orally. You cannot actually attach that to an IV cannula. When we're administering tablet form medication, it's really important that we have a look at the drug. Sometimes we may be ordered 150 milligrams of something that comes in a 300 milligram tablet. So how do we get the 150 from the 300? We have a look at the tablet. So we take one out, and if it's scored, meaning that there's a line across the centre of it, that means that we can actually cut that medication, that tablet. Sometimes it will be scored into quarters, so we can cut that tablet twice, or sometimes in this case, the medication just has one score, one line down the centre. So this is a 300 milligram tablet, but I require 150 milligrams. I'm going to need to cut that. Before we touch any medication, it's really important that we use gloves for the simple reasons that I don't want to absorb any of that medication through my skin. So I would never be touching medication with my bare hands, always put some clean gloves on. So here I want to cut this tablet in half because I only want 150 milligrams, and this is a 300 milligram tablet. I know I can cut it in half because there's a score down the centre of that tablet. You will find some medications, such as potassium, that come with a coating, an enteric coating, which means that we cannot cut that. There is no score down it, and it's the way the mechanism of the medication requires it to be slowly absorbed and dissolved in the body. So we are not to cut enteric medicated tablets. So this is a pill cutter. You open it, it's got a very sharp blade down the centre, and it's really important we keep our hands and fingers away from that because it can actually do some damage to your fingers. So we place the medication or the tablet into this little channel, and then we depress the medication cutter, the pill cutter. So ensure that the scored line is pointing down the centre of that canal.